Imagine needing to take an antibiotic for something simple infection, and end up resulting in debilitating nerve pain, chronic, long-lasting functional changes, and debilitating loss of your daily functions. Unfortunately, with some individuals who may have used some of these fluoroquinolone antibiotic class, so things like Cipro, end up having quite a neurotoxic response to them and can promote all kinds of dysregulation within the nervous system that lead to issues like chronic pain, scarring, and even mitochondrial dysregulation and long-term immune dysregulation. So if you've been an individual who has some weird symptoms following the usage of fluoroquinolone antibiotics, things like issues with your nerves or your cell health or your tendon health, ruptured tendons are a big thing with this as well. If you've been dealing with something like this, know that it's not something random that's coming about. There is heavily studied links to these things, and there are solutions for you to feel 100% better. It will take time, and it does take a significant amount of input and exertion and effort from your side of things in order to reach this full-time healing capacity. I'm Dr. Brad DeBeer. I'm with Axon Integrative Health, and I'm here to chat with you about fluoroquinolone toxicity, things that we can do to help, and why often traditional medicine overlooks it and doesn't have much to address for it. Also, reasons why functional medicine and functional neurology may be your answers out of this debilitating issue. Fluoroquinolone antibiotics work by disrupting the bacteria's DNA and how it replicates so that it can't replicate and continue to grow or infect your body. They are highly effective, however, it doesn't just stop with that dysregulation. That dysregulation also carries into your mitochondrial health and how your powerhouse of the cell is creating energy. This can lead to things like immune system dysfunction, chronic fatigue, stress, and anxiety. It also disrupts tendons and scar tissue regulation as well as collagen production. For these reasons, it's oftentimes that we have tendon ruptures when you're on a fluoroquinolone. That is one of the big contraindications of lifting weights or really stretching and really putting a lot of pressure on these tendons, because they are known to disrupt that connective tissue process and create tendon ruptures. It also disrupts collagen production, so healing from those tendon ruptures is most likely laying down scar tissue. So instead of laying down proper collagen tissues in your joints, in your muscles and your tendons and ligaments every day because of these little micro damages that happen, instead you start laying down scar tissue that's inflexible and creates a lot of rigidity, pain, and dysfunction within systems. So on top of damaging your mitochondria and creating connective tissue dysregulation, it also creates an oxidative stressor, which then has further dysregulations within vascular health and how we're delivering blood into these tissues that further exacerbates the issues that set on hand from the mitochondrial dysregulation and the connective tissue dysregulation. It also crosses the blood-brain barrier and disrupts productions of NAD, GABA, and glutathione, all molecules to help with energy production, antioxidation within the nervous system, and calmness into the nervous system as well. It also disrupts dopamine, and these changes within the brain and the blood-brain barrier can have issues into cognition, brain fog, and clarity. Oftentimes, these symptoms happen after maybe a few rounds of these fluoroquinolones, or you've taken Cipro maybe multiple times this year because you've had a few infections or gut issues throughout this time, and these symptoms usually show up a few months after. Oftentimes, people might dismiss them at first. Some traditional medicine docs might claim that it's all in your head. It's not. This is a physiological issue that happens at the cellular level throughout the rest of the body. Over time, these chronic issues can absolutely lead to negative neuroplastic changes, or what's called maladaptive neuroplasticity or neuroplastic pain, which in that circumstance is both a physiological dysfunction and a neurological, psychological dysfunction at the same time. Your brain, nerves, mitochondria, cell health is all interconnected beyond what you could imagine. So disruption in any one of these three, let alone all three, will have major implications into your health and these various neurological symptoms that you might experience. Things like neuropathy, cognition issues, autonomic nervous system dysregulation, energy production, and muscle weakness and tendon pain are all just common symptoms of fluoroquinolones. After a few uses, maybe if your cells weren't healthy enough to initiate this change anyways, we develop these big long-term issues within those 5 categories. One of the biggest specifics of fluoroquinolone toxicity is that it affects your vagus nerve. And this vagus nerve is highly implicated at regulating cardiovascular health, gut health, lung functions, as well as this big connection just from the brain and the body. This can lead into issues like immune function dysregulation, inflammation control issues. It can even lead into mood regulation, mood swings, and sleep issues as well. That's why many people in this develop things like cellular health issues, inflammation that's out of control, as well as chronic anxiety and depression. So how do we help people with fluoroquinolone toxicity? Here at Axon, we take a brain, body, and mind approach to every single patient. Our three main principles of care, no matter who you are, is cellular health, inflammation control, and positive neuroplasticity. With those three principles, we can address almost anything within the body. Fluoroquinolone toxicity is no different. So we start with those three, and we build a treatment plan with things like neuromodulation, TMS, transcranial direct current stimulation, TLNS, red light through the brain, things like that to help stimulate cognition, mitochondrial function, and brain health. We also look into things in the body that are going to help regulate cells and inflammation like PEMF, full body red light, and hyperbaric oxygen, as well as neural acupuncture and acupuncture. We also look at other techniques in applied neuropsych that are like neurofeedback and neurorhythm timing that are going to help the nervous system communicate better within itself. We also use things like IV therapies to help the cellular health and the mitochondrial health, as well as metabolic system as a whole at the core. In a functional neurology standpoint, we use quite a bit of sensory motor integration, vestibular rehab, eye movement retraining to help the symptoms that might have came up, the dizziness, lack of proprioception, cognition, brain fog, focus issues. All of those things tend to get trained through brain rehab directly, actually in this room itself. And with that combination of functional medicine and functional neurology, we're able to have these results that no other clinic in the country can reproduce. So if you've been having weird symptoms after taking some of these fluoroquinolones, you're not alone. Your body can heal. You can get back to 100% the way you were and avoid using them in the future so that this doesn't happen again. You have to work on healing yourself at the root level, at the cellular level, in order to see these changes slowly have a positive reaction in your symptomatology. Like I said, you are not stuck this way. If you want help with fluoroquinolone toxicity, give us a call at Axon Integrative Health. We'd be happy to chat. We have intensive programs if you don't live in the Denver area. If you do, we can work with you on a week-to-week, month-to-month basis. If you like this video, if you know somebody that would benefit, like, subscribe, follow us. We're really hoping to make a lot more of these videos in the future, helping to discuss and educate around certain conditions, injuries, and concerns to help people better understand what it is that they might be dealing with, as well as maybe some solutions that might help them. So if you found it helpful, like it, send it to somebody. If you want to hear anything else, leave us a comment about some certain topics you want to hear, and we'd be happy to help.